Hey y'all, so I have a couple hospice scenarios. So can a patient be admitted to hospice because a provider, outpatient provider says that, or a hospitalist, right, say that they need it. They say that they need it, okay? What about a scenario where a patient is sleeping more? Can they be admitted to hospice for that? And what about if the patient just wants it, or maybe they're lonely? What do you think? Okay, so obviously, right, if a provider refers a patient, to hospice, they could be appropriate, right? That's why you do the referral, you educate the patients, hospice evaluates them, right? A nurse goes out and does the evaluation and gather all the data. There are situations where a patient is referred too soon, right? Sometimes you just have those patients that are kind of in between and you're just not really sure what to do with them because they're declining, but yet they're not quite appropriate for hospice, right? What about the sleeping more, right? Could that be a sole reason to admit someone to hospice? Not necessarily, right? Because we need more pieces of the puzzle, right, to create a bigger picture. So are they sleeping more because their dementia is advancing, right? So maybe, there's more other symptoms, right? Maybe they're not walking as much, they're not talking as much, they're having trouble swallowing, they're falling, they've had repeated infections, they have wounds. There has to be more to the picture than just sleep. If someone has COPD, are they having more exacerbations, right, where they're needing steroids, or they're getting pneumonia more often, their oxygen needs are increasing? Or for example, right, heart failure is another one. Are their oxygen needs increasing? Are they needing more diuretic? Frequent hospitalizations related to their heart failure? You know what I'm saying? There's got to be more to the picture than solely someone just sleeping, right? Because they could be sleeping more, which could be leading to weight loss. But is it a medication side effect? Is it a organic cause? That's something on labs, whether that's electrolytes, or could it be a thyroid problem, or do they have a brewing infection, right? We have to have a little bit more than they are just sleeping.